right, good evening. First off, Dr. Yu, I just appreciate you taking the time out of your busy schedule to join us this evening. I do want to do a first quick introduction. Dr. Yu, currently in his path right now as an internal medicine resident, he'll be able to showcase just a sneak peek of his current healthcare career, just for us to get a better overview and perspective on the matter. And just also so happens to be that he's also able to shed some light on the unique perspective of him also being enrolled within the armed services as well. So he's also able to bring that unique perspective as well. And so we're looking forward to the discussion. So first off, I just want to say thank you, Dr. Yu, for taking the time out of your schedule to be with us today for this medical interview.
Yeah, of course, Alex. Great to be here. Thanks.
Awesome. Appreciate it. Well, without further ado, we'll go ahead and get started with the first question. That's tell us a little bit about yourself.
Well, I'm Ezra. I'm a second-year internal medicine resident at William Beaumont Army Medical Center in Fort Bliss, El Paso, Texas. My path to medicine definitely was a non-traditional one. Grew up definitely interested in the sciences, but not definitely set on a career in medicine. Volunteered at a couple different places throughout high school. It wasn't just all hospital work. Volunteered in animal shelters, in agricultural kind of fields, office work for kind of international ministries, but also didn't have definitely hospital volunteer experience as well. During college, I was a science major, but kept my eyes and path open to different fields. Thought about pharmacy, thought about kind of just wet lab research. But ultimately, what drew me to medicine was just the combination of science as just well as humanism, just interpersonal relationships, and more increasingly so, just an intercultural awareness and sensitivity that I think you don't really find in lots of other fields. So I had applied out of senior year of college. I had to reapply again. I took some post-bac classes in between, worked in the industry, healthcare industry, pharmaceutical industry for a few years, but eventually found my way towards medicine. And so I definitely look at every step of the way as kind of being necessary for my path. And so even though my path didn't necessarily look like others, and for this audience, which I'm guessing is a lot of people who use the student doctor network, I think you guys have seen a lot of ways to kind of skin the proverbial cat. And so I'm definitely someone who took my time towards medicine, but definitely know where I'm supposed to be, and that's here. And so I'm definitely enjoying it. You guys might see the circles under my eyes. Definitely lots of early mornings, late nights. I actually just finished cross covering the ICU this weekend, but I'm having a lot of fun, and I'm definitely where I'm meant to be.
Well, that's awesome. I appreciate it. And definitely sounds like you had a lot of interesting and unique experiences. So we love it. And I'm sure we could all be better for it. So I appreciate that. It seems like your resume and your experiences are very well endowed. So we appreciate that.
Yeah, of course. I think everything happens for a reason. And so to kind of go and bounce off of that, this question that says talks about how and why did I choose the medical school I attended. For those of you that might be in the process of applying or just start getting ready to apply, the first thing I would encourage everyone to do is cast a wide net. It is, just to be stark about it, a increasingly competitive field. Even as we are opening up more medical schools, we are having more people applying. Ultimately, why I chose AT Still University, the School of Osteopathic Medicine in Arizona, is one, they accepted me. Is one, you got to be accepted to school to be able to go. But two, I'm going to my multiple mini interview there, touring the campus and getting a chance to really just talk to faculty. I really feel like this school's mission and just focus on the underserved was really something that resonated with my own background and goals. I volunteered at a federally qualified health center during college. I myself come from an underprivileged immigrant family background. And so dedicating just medicine and what I wanted to do towards talents of people who may be less fortunate than me was really something that resonated with me about AT Still University. I had the chance to not only tour the campus, but to get to meet my fellow classmates. One of the other interviewers in my MMI group interview also actually turned out to be my best friend in med school too. And I didn't know at the time that he was going to go there, but someone who I had a feel like I had a good chance was going to go there too was someone that happened to be my interview group. And you really get a good sense of this classmates you'll be with during your interviews because you have people be applying too. And it just turns out that these are the people who helped get me through the COVID years of med school, the third and fourth years where you start to go into your rotations. And so it was a mix of things. One, the acceptance. Two, the mission. And then three, the classmates. And I'll kind of add to that the faculty that really helped kept me grounded, that really believed in me through some academically and personally tough times in med school. So looking back, you never know how the cards will fall, but they turned out very well in this particular case. And so very, very grateful to have attended AT still.
That's awesome. No, I appreciate that wonderful response. That's awesome to hear.
Yeah.
Okay, we'll go ahead and transition over to the next question.
Definitely one of the things that surprised me most about medical school is that how I really had to change the way I learned. Alex, I think both of you and I attended large research universities where there were maybe lots of people per class. And so there was very maybe published ways to succeed in the class, whether based on whether based, sorry, just kind of saw some family in the background, whether based on, tutoring, classes or, ratemyprofessor.com, et cetera, et cetera. Medical school really changed that game in the sense that there are lots of online resources that have been available. And, just to name a few: Amboss, Picmonic, Sketchy, et cetera, Anki, things that we've all found. And so because of distance learning, where maybe classroom time was limited and office hours are limited during the COVID years of medical school for me, I really had to change my approach to learning. And so I knew what to expect as far as okay, there's going to be learning the brachial plexus in the nervous system, learning pharmacology and all the different heart failure drugs that are out there. That's all expected, but the way to learn that and the way to really absorb all that information, really, I had to find kind of my own way to do it, and adjust during a period of time where we didn't have as much physical access and proximity to our instructors. So, for you, Alex, and I think for everyone kind of, starting medical school this year or the next, hopefully, now that things have we've kind of reached a new normal. Maybe we will find that we are able to kind of have different access, but I want to encourage you guys you're going to find different ways to learn and definitely take advantage of a lot of the resources that are out there. Because medical school is hard, but it's passable. And I passed, I got through it, and you'll get through it, Alex. And, everyone listening here, kind of wishing you guys good vibes too, as you apply and start your medical journey.
Well, I appreciate that reassurance, especially during that critical time during COVID-19. I can't imagine. So just resiliency and perseverance. So, but I appreciate that. Thank you for that.
Yeah, Alex, it was definitely one of the tougher times in life, just because of the isolation, just the sense when is everything going to get back to normal, or will things ever get back to normal? And so we all got through it. So I'm grateful for just, again, the faculty and friends I was able to lean on, maybe not necessarily through being in person, but through things like, Slack or Zoom or things like that. So internal medicine, to kind of transition to the next question, I think really just combines so many parts of medicine that I was interested in. I love the idea of being able to do a differential diagnosis and think through and mentally exercise what a patient might be dealing with. I love the fact that you do have the opportunity to subspecialize in things like cardiology, gastroenterology, pulmonology. I'm in the ICU right now, so pulmonology, critical care is one of the options that internal medicine internists have to subspecialize in, and that's been really, really interesting too. And so I just like the intellectual aspect of it, as well as the career flexibility. For the people who just stay as general internists, you have hospital list positions, you have clinic, you can go to teaching faculty, so many different ways. I know like an internist that works in assisted living facilities as like a medical director. I know
Mhm.
internists who have gone in to do wound care for the community. Um, and for me, with one day hoping to pursue medical missions one day, I think internal medicine provides a really good background to be able to approach and be comfortable with dealing with a wide variety of disease. So,
No, that's awesome. I appreciate that. It sounds like internal medicine has a breadth of experience, so we appreciate that too.
internal medicine definitely has that breadth. I would say family medicine is very similar in the sense too. One of the changes for me, and maybe what I think as I kind of thought through my career, was I really also enjoyed working in hospitals too. And so internal medicine, we're a very inpatient heavy residency. Um,
Absolutely.
like my intern year alone, I had like 6 or about 7 months of inpatient wards, which really do prepare you very well to work in a hospital setting. Um, Ultimately, that was something that pulled me towards this field. I think family medicine does provide inpatient settings too. And there, even actually within the Army, there is actually a hospitalist fellowship in North Carolina that one can pursue if you come out of family medicine residency, wanted to maybe pursue more of an inpatient setting. But for me, internal medicine does provide that outpatient setting too. We get every 4 weeks of a Y week in clinic where we are working in an outpatient setting. We also do have a very heavy inpatient focus, which I really enjoy too. Um, in the hospitalist industry and just hospitalist groups are really popping up, all over the nation.
Yep.
Most hospitals are staffed by a hospitalist group, and so that's been a field that I've definitely thought about going into, and so definitely considered, IM, FM, IM peds, med peds, as a lot of you might know it. Unfortunately, the Army does not have that. So internal medicine really provided the kind of best fit personally for me. And so for all of you guys, I would encourage you to really, not to go into a field because of the money or because of the prestige, but really because you feel like it's the best fit for you. And that's how was internal medicine was for me.
Wow, that's awesome. I appreciate that.
Definitely would. No regrets about it. Um, I I guess I'm still in the process of maybe thinking about fellowship, and so to kind of unpack this question a little bit, um, you know, I, I I'm definitely like a very early career, practitioner. Like I haven't even finished residency yet, and so I would definitely still go with internal medicine. Um, I'm currently in the process of trying to figure out, like, yeah, do I want to be a specialist or do I want to stay as a general internist? So yeah, as kind of a just to sum it up, definitely would do internal medicine again. Currently, thinking about different subspecialties. So.
That's awesome. Anyone in particular? I know it's still an open decision point, but is there anything that kind of leaning towards, or just kind of have an open idea with on a specific path?
I definitely have really enjoyed the ICU rotation.
That's
Critical
awesome.
care really allows you to focus on kind of the salient points of someone's survival. People go to the ICU mainly for one of two reasons. One, they can't breathe, so they're on a ventilator to help them sustain like their airway. For those of you that might come from an EMS background, airway, breathing, circulation. Airway is the first thing, and a ventilator automatically puts you in the ICU status. You're either on that or on a medication called a pressor, which means like your body has started to fail to function, organs aren't working,
Hmm.
blood isn't either perfusing your organs because of like septic shock, you're losing blood or losing volume because of hemorrhagic shock. Um, you may not be able to get blood to your organs because of some obstructive shock like cardiac tamponade, tension pneumo, or just general pneumothorax. So yeah, like you and learning the physiology and just what all goes into management of ventilators and pressors. That's been a really interesting thing for me. You still can have lots of wide variety of diseases coming through the ICU. But critical care specialists, at the end of the day, I think get to be really good at a few things and to do them well. And so I can say you can kind of apply that to like a ton of other things, but cardiologists, gastroenterologists, pulmonologists, infectious disease, they kind of do have like a really wide range of things to think about. But I think critical care specialists, and I think maybe I'm biased just because that's the rotation I'm on right now. Really
Yeah.
get to be, a master of a few trades, I think.
No, that makes sense. No, thanks for sharing.
Yeah, I mean, like we talk a lot about the automation of medicine. We all know how AI is starting to become more and more, a thing. But as good as an AI is not going to be able to do a rapid sequence intubation, or an AI is not going to be able to have that hard conversation with the family about change, like goals of care, about whether someone on a ventilator, um, you know needs to continue on it, or maybe talking about withdrawing life support. Um, an AI can maybe like weigh, the chances of someone going into acute respiratory failure from asthma exacerbation. But an AI is not going to be able to tell someone, this is how you use your inhaler. This is how often you use it. This is how to recognize signs of an asthma attack, and how to do it in a way to where someone that may not necessarily have a lot of medical background understand. And so, definitely, definitely enjoy critical care, and we'll see. We'll see where things go. So. So being a physician definitely has met my expectations. I knew it would be a fun, rewarding field. I also knew it'd be tough, take lots of hours,
Yep.
and definitely something that requires a lot of sacrifice. But I think to kind of build off of that, and maybe to go into why I'm really happy about my path, is that I did have a few years out of college to experience life and to build up some really important life skills financially, even just emotional development, learning how to relate to others. I worked a few customer service jobs in retail that taught me how to deal with difficult schedules, difficult people. And so that did help me prepare for medical school and for a career in medicine, in the sense that um, maybe as a person, I was a little bit more equipped to know what to expect and how to handle those things. And so 110%, being a physician has met my expectations, both in kind of the good things and maybe some of the not so easy things.
That's awesome. I appreciate it.
I like the most about definitely patient care, being able to connect with a person who may be in a very just vulnerable, tough spot, and one, helping them through their whatever they may be going through, medically, but also definitely connecting with them and their families as they navigate this journey. Like, people are sick for all sorts of reasons. Sometimes it's because of social determinants of health, circumstances about lack of access to medication, maybe a lower like medical literacy, maybe not being able to have a continuity of providers. We see lots of people here in the VA who are constantly having their doctors change just because for different reasons that come with maybe acute exacerbations of chronic illnesses, whether that be asthma, like I just mentioned, or diabetes, people going to diabetic ketoacidosis, maybe someone with a chronic diabetic foot wound that just hasn't gotten proper care because they haven't been able to see a podiatrist because there's a lack of podiatrists in the area, that suddenly goes into a ulcerating gangrenous foot wound that now we've got to call vascular surgery for, and have goals of care discussion with the patient about, hey, we may be looking at saving your foot from having it amputated, or maybe amputating the foot to like save you from death because of septic shock. So those are hard conversations, but I think like connecting there's just definitely, I think, an emotional, personal, and spiritual connection that you share with the patients that honestly I really haven't observed in any other field. I have lots of friends who work in great careers, but there's nothing quite like that. Kind of on the flip side, sometimes those conversations, and these journeys are mentally taxing and emotionally taxing. Lots of patients turn the corner and do well. Some of them don't, and whether it's because of a mistake that we as the team made, or something we missed, or just that the patient was just too sick, maybe beyond saving, or if different reasons, patients suddenly develop like multi-drug resistant organs. Something happened on the floor to where um, a diagnosis or lab error was missed, or if the patient had to go very risky surgery that ultimately did not turn into a good outcome, just because of the risk. Those have definitely been tough conversations, and so the highs are high and the lows are lows in medicine. It definitely humbles you, and it definitely some nights definitely keep you up thinking.
Appreciate that.
A typical day definitely depends on the service that I'm on. So as I alluded to earlier, um, each month, or I guess every few weeks, you're either on an inpatient or an outpatient service. The inpatient services, whether it's cardiology, critical care, or the general medical surgical wards, generally start with a morning handoff at 5:30. You get a report from the night team who's been taking care of the patients overnight, who the patients were, what happened for them, any emergencies that happened. You generally will round for a few hours, talk with the patients, find out how they're doing, talk with your attending, and come up with a plan for each patient for that particular day, whether they discharge from the hospital, stay in the hospital and get further care, or maybe even upgrade to the ICU for a more critical service, or in my situation, if they're from in the ICU and are ready to downgrade to maybe a less intensive or general standard of care, standard of care, always the same.
Correct.
Whether they downgrade it from the ICU to the wards. And the execution of that plan generally takes like the rest of the day. There's so much that goes on with each particular patient. Phone calls to make, medications to order, communication. Communications that have to be made to nursing, pharmacy, and other staff. So that ends up taking up most of the day. If there are lulls on the inpatient service, maybe whether we don't have many patients, or I'm just waiting for some lab values to result, or seeing how a patient does, like on their ventilator for a few hours. We try to be productive with our time. That our staff, our faculty, tries to kind of sit down and teach us about different medical topics. I'll often have a question bank pulled up and do questions, flashcards as things are waiting. And then the end of the day comes at 5:30 in the afternoon, where we sign out and essentially tell the night team kind of the situation with each patient, what is going to be happening to them, and maybe any contingency plans or orders that may need to be followed up on or be aware of for each patient. So that's what my days look like the last 2 weeks.
No, that's fascinating. Being in the armed forces, are there any additional responsibilities that you may or may not need to incorporate into your daily schedule, or is that just kind of pretty typical or standard?
Yeah, specifically as it relates to the armed forces, I myself am active duty, a soldier kind of within the troop command and student detachment of the hospital. And we do have soldiers that come in through the hospital in our service. I think trying to be maybe as hip as possible. Lots of the soldiers we have are either in the process of deploying. Soldiers have to stay kind of physically and medically fit for their duties. So responsibilities and things I have to keep in mind is that whatever happens to a soldier kind of in the hospital and what their outcomes were have to be communicated to their command and the people that are overseeing them once they discharge. These people are going to want to know, like, is this soldier continue to be fit for duty? Are they able to deploy? If they're not, like, what kinds of restrictions need to be made? I think, Alex, you might be familiar with the profile, like the term profile, like what kind of things should they be restricted from doing like certain exercises from the PT test. Like, are they able to deploy to like certain environments? Are they able to operate certain equipment or machinery, et cetera, et cetera? And these are things that you get a good sense for maybe in medical school, because of we learn different diseases, like what kind of meds people need to be on, maybe some outcomes. But specifically as it relates to the military, we don't learn what a helicopter mechanic does. We don't learn
Correct.
what a soldier in infantry, how many pounds he has to carry in his rucksack, or how many miles he's expected to do each year. And so, or each day in a PT march. And so, not only do we in residency do I learn treating disease, but we learn a lot about soldiers and what they do, the units that they fall under, the expectations from command. So that's been a really, really enriching part of my education too, because one of the reasons I joined the Army was to serve soldiers and serve veterans too. But specifically being active duty, that is one of the main differences I have as compared to maybe a civilian counterpart.
Correct. No, absolutely. No, thanks for sharing.
Average amount of hours a week I work this week, I've been pushing about like 60 hours, 65 hours of sleep per night. I try to range between 6 to 8 weeks of vacation per year. We generally get 30 days of leave per year. I try to take about 15 to 20. I try to leave about 10 days as just margin time in case I get sick. But I generally try to take at least like 2 weeks cumulatively throughout the year. So, in 2024, I took 3-4 days to visit some friends in Arizona. Took about another 3 days to visit my family in the summer. Took 3 more days in the fall to visit some friends in Arizona again, and then 7 days in the end of the year to visit family for the holiday. So that's kind of how those numbers have fallen for me.
Awesome.
Definitely satisfied with the income. I think maybe just to give you guys an idea, we make about the same as most people, residents, across the United States will make, because it is a fixed income, right? We're not technically not employees of the hospital. We're employees of, or paid, or income paid from federal sources. So most residents' income comes through CMS, Centers Medicaid and Medicare. Within the Army, or in your case, Alex, the Air Force or Navy, my paycheck comes from the U.S. Army, and so I'm paid as a captain in the U.S. Army would, in addition to residency pay, as well as my basic housing allowance, what the Army determines how much I need to live in El Paso. I think this question is not necessarily asking me to say numbers, which so I'll refrain from saying that, but I am satisfied with the income, and I live very simply. So definitely no regrets there. And Alex, you're from El Paso. It's quite definitely very affordable here.
Absolutely.
My payback will involve active duty service for people that may face debt due to educational loans. I would say definitely look very simply. Definitely look into options like public loan service forgiveness, which I know is kind of in flux just because of just things going on. And like again, I say never go into specialty for the money, but be smart, and in terms of just like mapping out, okay, this is how much I'm gonna have to pay back over the next few years, and this is how much like I'll have to make to do it. And so I would say like find a financial counselor, live below your means, live as simply as you can, to go out there, buy a Tesla, when you graduate, and definitely, I know that these things are in flux, but look for ways to pay them back. Like I joined the military during medical school, but there are people options to be able to join after you graduate, and so there's definitely lots of different ways to approach it. And my encouragement to everyone is to not let um, seemingly difficult financial constraints limit you from uh, pursuing this road.
That's awesome. I appreciate you sharing that, especially with the fact that a lot of individuals might be worried, thinking that there's only one direct route of paying for medical school, but you shed the light that folks actually get enrolled in HPSP, which is the House Professional Scholarship Program through the military service, or there's even folks that actually complete their medical school and then they go into the armed services afterwards, and they also have other programs such as the public loan service forgiveness loan as well. So I appreciate you sharing that there's different avenues or opportunities that students or medical student graduates could take advantage of. So thank you for that.
Some information and advice I wish I'd known before school. Um, Most things were kind of expected. I think I just would have wish I was more aware of some of the resources, supplemental resources like Amboss, Anki, um, Sketchy that were out there. I learned how to use these during school and kind of later in my preclinical years up to leading to my clinical years, and I found a good rhythm. I would say earlier on there definitely was a adjustment and some difficulties beforehand, and I think if I'd somehow become familiar with these and found a way to use them well, definitely would have hit school um, with a better stride. I think it was still difficult because the volume, there's just nothing really you can do. Like there's never going to be a less volume to cover. If anything, just as we move forward, there'll be more volume to cover. But I think if I had a way to know about these resources and develop a good kind of study plan that just really fit the individual, that's probably what I would have wished I'd known.
Awesome. Thank you.
Access, that is what I see.
Mm.
And so especially maybe dealing with the VA or maybe even active duty folks that just one like don't know how to find a PCM or like don't know necessarily like what specialties um, need to be involved in the course of care. And so in healthcare today, whether that be in our country or others, access in literacy are a huge thing. So maybe that falls under social determinants of health. I think there are lots of things that kind of fall under that. But as I've seen, social determinants play a huge role. And all of them are determined by maybe factors we can't control, like where we're born, demographics, ethnicity. And so there's not an easy answer to that problem for sure. And I can't pretend to really have any good answers right now. But as I kind of worked in the system that I do, that's something that's definitely been more and more apparent to me.
No, I appreciate that. Thanks for sharing.
Internal medicine 10 years is going to continue to develop, and like every field, it'll have to find a way to work with AI. Chat GPT is great, but I think
Yeah.
as I was referencing earlier, um, great for information gathering, great for pulling up and maybe synthesizing data, but it can't have that hard conversation with a person. It can't necessarily, um, you know, relate to someone that may be really having a tough time. And so I think internal medicine is going to hopefully develop a symbiotic relationship with with AI technology. I think I see a lot of development of emergence of our colleagues in advanced nurse practicing, as well as our physician assistant colleagues. Healthcare, and let's talk about access, um, as we hopefully try and cover a bigger part of the population. I think I also see us leaning heavily, kind of our counterparts in advanced practice as well. Um, and a lot of it elsewhere, hopefully we figure out better answers to lots of the cancers that are out there. Hopefully we find out better treatment of heart failure, and these things. And we've seen that within the past 5 years already, with the emergence of a lot of the SGLT2 inhibitors and the mineralocorticoid receptor, antagonists, which have really increased lifespan and outcomes in people that maybe did not expect much after heart failure diagnosis. And so I'm very positive. I've always been that way. I think you know that, Alex, from talking to me. I think I definitely see internal medicine in a very good place a decade from now.
I appreciate your perspective. I agree.
Outreach and volunteer work. I do volunteer with a church ministry on post, and every first Saturday of the month, we're involved in a food bank on a food distribution project every first Saturday of the month in the Clint, San Elizario area. Alex, I think you might know, is like a couple miles southeast of El Paso.
Yes, absolutely.
It's a great partnership with a local church, and again, talking about access, providing just resources and food towards people in need. We get to have a chance to share food and our faith as well with them, and it's a very fulfilling project.
And you also have your own pages as well, and fundraiser and running clubs as well. So I appreciate those messages as well that you send out.
Yeah, free time. The free time I have, definitely, I'm involved with a local church, and so faith has always been a big part of my life. Hobbies, as you referred to, Alex, running. I like running. I got to run for the Army, so there's that. Yeah, I always try to work out, exercise. I'll learn how to cook different foods, etc., etc. But definitely, that falls under, I think, the branch of maybe self-care and mental health and wellness, which I think are huge towards surviving and thriving in residency.
Awesome, thank you.
In this current role, I think definitely being persistent. I think a lot of things you guys hear in school and just your interviews is distance traveled / grit and just life experience. I think definitely just being willing to put the nose down and to the grindstone and work has been one. I think being a team player has been huge, not only for getting through the curriculum of school, but in just this current role, you've got to be a team player to succeed in residency. Quality, I think, was maybe more a tangent to the question, but I think referring to faith, definitely just my personal faith has definitely gotten me through the tough times of school, but also just some of the tough situations in residency too. So those all play together to help just get through the grind. Yeah, because residency is a grind. It's fun, but there's no getting around it. It's tough too.
I appreciate you sharing. Those are some wonderful qualities, and you're a testament of being successful in that path and just all the milestones that you were able to accomplish. So that's awesome.
Thanks, man.
Well, Dr. Yu, that was the final question. I just want to say thank you again for taking the time out of your busy schedule to provide your perspective and your story. I just want to say thank you again for being able to be here with us today in partnership with Student Doctor Network, along with our Health Professional Student Advisory SAC organization, and being able to share your story along with your words of wisdom for all pre-med students and those that are seeking their medical endeavors. Thank you again.
Yeah, of course, Alex. Thanks for having me. Just want to encourage you in this journey and just everyone listening. It's tough, but I know you guys can get through it. So thanks for taking the time to listen in.
Awesome. Thank you so much.